Introduction. The bladder is a hollow organ in the lower abdomen that stores urine. It has a muscular wall which contracts to help evacuate urine from the body through a tube called the urethra. Bladder cancer is a condition in which cells of the bladder become abnormal and grow out of control. It usually involves the inner lining cells called the urothelial cells, but can also involve other cell types. The cells multiply, forming a tumor, and may spread to the underlying muscle tissues and to other parts of the body. Causes. Cancer occurs when cells undergo changes in their DNA, causing them to behave abnormally. What causes these changes is unclear. Certain factors that increase the risk of bladder cancer include smoking, exposure to certain chemicals, chronic urinary infections, being male, increased age, a positive family or personal history of bladder cancer, poor fluid intake, a history of radiation therapy to the pelvis, a history of chemotherapy with a drug called cyclophosphamide. Signs and symptoms. If you have bladder cancer, you may experience blood in the urine, increased urgency to urinate, increased frequency of urination, pain with urination, lower back pain. As bladder cancer progresses, you may have loss of appetite, tiredness, difficulty with urination due to blockage. Diagnosis. To diagnose bladder cancer, your doctor will carefully review your symptoms and medical history. The following tests and procedures may be performed. Urine cytology. A sample of urine is obtained for examination in the laboratory to look for cancer cells or other abnormalities. Cystoscopy. An illuminated tube with a camera called a cystoscope is inserted through the urethral passage into the bladder for examination. Biopsy. A sample of tissue may be obtained with the help of instruments inserted through the cystoscope. The sample is then examined in the laboratory. Imaging studies. Your doctor may order imaging tests such as a CT urogram and a renal pyelogram for a detailed view of the structures of the urinary tract. Contrast dye is injected to enhance imaging. Additional tests such as a chest X-ray or bone scan may be performed to see if the cancer has spread to other parts of the body. After a thorough evaluation, your doctor will determine the stage or grade of the cancer, which indicates how severe or invasive it is. Treatment. Your doctor will recommend a treatment plan based on the stage and grade of the cancer and your general health. Treatment for bladder cancer may include surgery. In cases of superficial cancer, your doctor may recommend a transurethral resection of the bladder tumor, TURBT. This involves removal of the cancerous tissue using an instrument inserted through the urethra. For cancers that have infiltrated the muscular layer of the bladder wall, a cystectomy, which is a removal of all or part of the bladder, may be recommended. A radical cystectomy may be necessary for advanced cancer and involves removal of the bladder along with nearby lymph nodes and other organs such as the prostate in men and the uterus in women. If the bladder has been removed, your surgeon will perform an additional procedure to provide a means for urination called a urinary diversion. It usually involves using a part of your intestine to create a pouch for urine storage with a passage to the urethra or an opening in the abdomen called a stoma to expel the urine outside the body. Chemotherapy. This involves the use of anti-cancer drugs administered through a vein or directly into the bladder cavity. Radiation therapy. This involves administration of high-energy radiation to kill the cancer cells. Immunotherapy. This type of therapy enhances the immune system's response and is usually recommended along with surgery. Targeted therapy. This treatment involves identifying a weakness in the cancer cells and using special drugs to target only the cancer cells. Your doctor may recommend one or a combination of treatments. Summary: bladder cancer is a rare condition that usually affects elderly men. If detected early, it can be treated successfully. Various treatments are available, and the outcome depends upon how advanced the cancer is, as well as other factors such as your general health. Since recurrence of bladder cancer is a possibility, those who have undergone successful treatment are instructed to carefully follow up with their doctor for a number of years.